Hi, my name is Vonda Pearson, and I just want to say thank you for allowing me to be on here today. Actually, my story is was just very odd. I was 56 years old, and with the family and everything like that. And everybody had family discussions, disagreements, and things like that. But you just never know what that can do. I just happened to be in a conversation with one of my young nieces, and it just got a little the disagreement, and I raised my voice. And at the time that I raised my voice, I felt a tear in my just in my chest, and I was like, "Wow, what is that?" Because I've never felt anything like that. So it literally felt like a zipper, something had torn inside of me. So I didn't do anything about it, but and I didn't know about any symptoms before then, so that was just something that happened. 2 weeks went by, and I did notice I was short of breath, but I didn't think anything of it. And one night I was laying down, I think it was a Friday night, I was laying down, and it felt like an elephant was sitting on my chest when I laid on the left side. Then I turned to the right side, and I kept feeling that. I ended up going into the hospital. I took myself down to the University of Penn. They looked at me. They asked certain questions, but at that point, it wasn't. Nothing was diagnosed. I was in there all night. They sent me home. I went back in on Saturday, and when I went back in, I gave them the same symptoms again because I still had but this time I wasn't sleeping. I just really felt the pressure on my chest. And when I said, I got to go back to the hospital. So I went back to the hospital and presented the same way. And this is where I met Dr. Sangavi. And she and other team of doctors came in, and they asked specific questions. She really did ask specific questions, but what I was really impressed with is that she paid attention to when the doctors was asking me questions, and you could just see how she was just like looking to see if there's anything that it could be. So she actually, after a few questions, she said, "That sounds like SCAD." And I'm looking like, okay, what is that? So, from there, she kept me. They did a lot of tests. And in the test, they did the troponin levels, and then that came back showing that I had SCAD. So I had the tear in the lower part of my heart. I think it's the OM2. I can't remember right offhand anyway. But I'm grateful I didn't have to have a stent. But they did keep me in the hospital to get me back together. But what I will say, it's really scary, I think, because even after I was diagnosed with that, because I was very active in my life. I worked out a lot, but it was scary because it was something that minor, just having a heated conversation, and for that to tear my artery the way that it did, it just goes to show you. I guess it was just thinning, and they did the test of FMD, fibromuscular dysplasia, um, and found out I have that. So, I mean, right now it's still a little emotional because for a long time, rehab was great. I met some wonderful people there and stayed in contact with some people there. But it's really emotional because for a long time I was scared to do anything because I would just think about my heart racing. If I do anything too much, will it cause my arteries to tear? So it's been a journey, and even now, because I'm older now, and I'll be 65 this year, and I do plan to retire, but I realize I do watch my body because right now I'm wearing a heart monitor, because one of the things too that I'm finding now is I get a double breathing, and I don't know if that's the cause of that or not. But Dr. Zangavi really do. She looks out for me. I can always call her. She do all of the testing and all of that. So I still get a little emotional because it's scary. Because it has stopped me from doing a lot of things. I don't like to get on planes because I'm scared half the time. I do stay away from stress. I stay away from anything that will cause me a lot of stress. I stay away from anything that will cause me to raise my voice. I try to calm myself down with my job because there's a lot on there too. So, yeah, it's even though even when I talked to Dr. Sangavi, to me it didn't seem like a big thing because I didn't get stents and stuff. But I think the beauty of my story is it doesn't have to be a big thing to make that happen. It could be something as small as raising your voice or something as small as anxiety setting in. And if your arteries are already a little thin, then that can cause more of it. So I had to look at it from that perspective that you can look at things can happen at the smallest little thing that can cause anything to happen. So I just wanted to share that and thank you. And hopefully that it will be able to, have someone else, just be mindful of what they do and just really still trying to understand what this disease is. Thank you.